Hi again, everyone. Welcome to Health Focus. I'm Ava Anna, and I am the host. And I am with
Anna Marie Sinatra from Sinatra Solutions and Health Matters, and I am the host.
Yes, and we are excited to be here to do a crossover show.
Yeah, this is really exciting. You know, I'm always so happy when we come together, we partner together to do this crossover show. And I've noticed some of the other programs, you know, on mainstream primetime TV are talking about crossover shows now, and I think they got that idea from us.
I think they did too.
I do.
They're
I
copycats.
Do. Yeah, they are.
They sure are.
Because we partnered together so that we can bring you wonderful information, because that information gives you power, and that power enables you to make better choices in your everyday life, or if you're unfortunately you might have an injury or an illness that needs some attention, so we bring you some information to help you with that.
Knowledge is power.
That's right. And partnering together, we get we hit a lot of people.
Yes,
Yeah.
we really do. One within the different counties that we are shown. And we try to provide interesting subjects too, you know, to keep everyone's interest that you might be interested in. You can always email Anna Marie or myself. My email is quilter215@roadrunner.com.
And I'm going to send you to my website, sinatrasolutions.com, where you can get all the listings of all the times that this program is shown, as well as my program, Health Matters, and Ava's program, Health Focus.
All right.
And before we get started, you know, I always like to thank my sponsors. Sponsors are what keep this program happening all throughout Erie County, and we've got a corporate sponsor, and I'm excited because they're with us today. little note. Oh yeah, and do make sure that you take out your pens and papers. Pens, and papers.
Pens, pencil, or papers?
There you go. Because we got some great information for you, and I'm so excited because one of our corporate sponsors, which is Western New York and Lockport, New York MRI, where Dr. Frank Mascaro is so committed to the community being educated so that you'll know what to do if you're in a health crisis. They've been our corporate sponsor for quite some time now, and they bring us state-of-the-art, cutting-edge diagnostic imaging equipment to help you when you're in need. I said it right. And he knows.
Excellent.
He's sitting right next to me. You'll see in just a minute. But I also want to thank Melinda from Renaissance Hair Salon, where she uses all natural products to bring out your natural beauty. Because, you know, I'm a broken record, because for so long, many years, we start looking at what we put in our bodies, you know, in terms of organic and trying to eat healthy food. And I'm here to say it's just as important what you put on your body. You know, all those lotions and perfumes, they lead to problems. Dr. Frank might be happy because he'll see you, but we're here to keep you healthy, and so that you know that you have good, healthy choices. So those are our two sponsors for today, and our corporate sponsor is here with us today.
Corporate sponsor? Ooh,
Corporate
okay.
sponsor, yes. So, anything else you want to say?
No, that's, we're ready to go here.
Oh, wait, yes, no. See, I knew we were leaving something out.
Oh, we weren't? Okay.
You're going to be able to see Ava and I at 2 health fairs this month, in the month of April. Last week, if you watched our show, you saw the people from Earth Spirit Expo, and that's coming up April 4th and 5th at the McKinley Conference Center on McKinley Parkway in Blaisdell. And again, they can go to my website or email one of us to get that information. Ava and I have a table there, so we're going to be there to share some good information with you. And also the Buffalo Well Fest. This is a really big one. This is a very huge one. It's Friday and Saturday, April 17th and 18th from 10 until 3 at the Statler Towers.
Everybody know where the Statler Towers?
I don't know. Do you know where the Statler Towers is?
Statler Towers is downtown, and it used to be the old Statler Hilton.
Ah.
That's where it is. Right where the McKinley Monument is, there's a Statler Towers. Yes, when you're going down, if you're going down toward downtown, it's on the left-hand side.
Okay.
Statler Towers.
And remember, you can go to my website to check out all that information. And so anyways, without any further ado, as I said, I'm so excited because our corporate sponsor is here today, Dr. Frank Mascaro and Dr. Krishnan Kartha. Krishnan Kartha. I'm stumbling over it, and here I said it before last time we visited Lockport MRI.
Yes.
Welcome, and thank you so much for being here.
Well, thank you for having us.
Yeah. So I'm really excited because we've been on location to Western New York MRI, and to PET CT, and to Pinnacle, and to Lockport MRI, and that's what we're going to talk about today, Lockport MRI.
Correct.
Yeah. So tell us a little bit about what you want our viewers to know today.
Well, first of all, it's great to meet you, Ava, and Anne Marie always. Lockport MRI was the first MRI center here in Eastern Niagara County and provided services for the population here in Eastern Niagara County, you know, Lockport and down to Alcott and Wilson and far east to Barker. But also, we've attracted a fair amount of Canadian business that comes across, you know, with the 3 bridges in Niagara Falls to utilize Lockport MRI as a great facility, and it's an all-digital facility, meaning that if you bring your script in, we scan it, and then you're part of the electronic record. So there's no real paperwork flying around anywhere, and it's also what's great about being an all-digital center is that your referring physician, your doctor, will be able to view the images immediately, as well as get his report within 24 hours, a written report in your chart back at your doctor's office within 24 hours.
That's what we were talking about earlier when we were talking with the doctor. When you're out of the country or out of the state, no matter where you are, Dr. Frank could get you those images so that you're able to read them right away.
That's right, I can read them. Anywhere I can get to a computer, I can read the images. And I believe last time I was talking to you at Lockport MRI, we were just started putting in some of this technology. So as Frank was saying, we can look at those images anywhere. Patients, your doctor, can look at them also anywhere they can get to a computer. And as Frank said, the reports, we get the report done in 24 hours, but they don't have to wait to get the written report. If they can look on the computer, the report will come up along with the scan.
And see, and that's what's so different about your facilities is that your care for the community and for the people in the community to have the cutting edge. I mean, I know I practice it and I laugh about it because I want to say it the right way, because I am your viewing audience. I'm not the medical person, although Ava is a nurse, so she's got that part covered. But it's important for people to know. We were talking earlier about what just happened in the news, and who knows, there might have been a different outcome if they had.
Right.
Ava, you speak to that because you know all that technical stuff.
Right, what happened, you know, with Natasha Richardson in the skiing accident, and I was asking our doctors if it can be detected on a MRI, and you had said no, a CAT scan as opposed to an MRI to detect that?
I'll defer to Krish on that, but I think CAT scan acutely would be the better choice within the original initial injury. But you know, Krish,
As Frank said, I don't know the details of her case, obviously, but for an injury to the head, CAT scan is the first choice. 1, because it's very fast. 2, because it's very sensitive for the presence of blood. MRI can see it too, but CT is really sensitive for that recent bleeding, and also it's very sensitive for fractures. So in an emergency like that, CAT scan is the first thing to do, and it picks up injuries like that very easily.
Very quickly.
Yes.
Yeah. No matter where you are, you can send them out to doctors, experts, and
correct.
yeah, that's
right.
pretty amazing.
Yeah. What we found, listening to our referring physicians and doctors, what's important is that sometimes if your doctor's away on vacation or at another site, as long as he has access to a computer, he can get that information. And also sometimes, you know, if one of the partners of your referring physician is kind of watching over you and you get acutely ill, I mean, one phone call to your doctor anywhere in the world, he can confer on images and say, yeah, this patient had that before. So it's really important. It's communication and helping patients get the right treatment for whatever illness they have.
Do you see a lot of traumatic brain injuries, head injuries?
Quite a few.
Wow.
We also work at ECMC, so we see a lot of trauma. I mean, that is the trauma center for this whole Western New York. So it's, I train there, so I've seen the gamut of
Also,
traumatic injury.
My subspecialty is neuroradiology, so it's all it's brains and spines, and I spent 4 years in New York City doing level 1 brain trauma center brain imaging. So lots of head brain trauma.
So sorry.
No, go ahead.
The brain, okay, isn't it surrounded by the fluid, the cerebral spinal fluid,
Correct.
Right.
Now, so when you have an injury, like they say brain whiplash or whatever, now does the brain go against the skull? Is that it? Is that what happens?
That's one way it can happen, yes.
Okay.
Especially acceleration, deceleration images like car accidents, or your head may suddenly come forward, or be whipped back and forth. That's the brain. Your head goes forward and then back. The brain may still be going forward while the skull is going back, and then you have an impact.
And this past weekend showed us how important it is to utilize some
Exactly.
good diagnostic imaging equipment so that you know what's going on, no matter how slight you think the accident might be, that our bodies really are frail. We bounce back, but with the technology that we have today, you know, I feel bad. That should have never happened.
Yeah, it shouldn't.
Yeah,
Yeah.
yeah.
To continue answering your question, though, about brain trauma and imaging, we said in the acute situation, you do a CT. MRI can be very helpful after that. People can have head injuries and have really immediately, it doesn't seem that bad, but it just seems to linger and not go away. And sometimes for that situation, brain MRI is more sensitive. It can find subtler injuries that, you know, may not have been a bleed like in this situation, but like a subtler area of brain injury may show up on MRI later on.
Right, or like with the CVA or stroke or whatever.
Yeah, correct.
Yes.
Exactly.
Now, talking about Lockport MRI, because that's what we wanted to focus on today, is that you're at 170 Professional Parkway.
Correct.
And I know I've been there. It's just as beautiful as all the other centers that you have too. Your commitment to excellence and bringing to the community, you know, the best equipment really shines throughout all of them. And tell us a little bit about what kind of equipment that you have there, and for people who are watching today and may have a small injury, not think that it's much, but let us know like what they might want to come to Lockport MRI for.
I'll give you a quick overview, and then Krish can give you more of the details of the specific image, the MRI that we have at Lockport MRI. The MRI is a G 1.5 Tesla MRI. What we try to do at all our centers is not only provide great imaging abilities by the machines that we choose, but also, you know, set up a nice environment. You know, the patients usually are not feeling well. You know, they're anxious about an exam. We want to give them a great environment to kind of calm down, you know, get the exam done, and then get the results in a timely fashion. That's our motto for our practice, and I think we follow it in all our centers, as Anna Marie has been to a few of them. But Lockport MRI is very important in the regionalism of imaging that we do here in Western New York. And I think Krish can elaborate more on the MRI that we have at Lockport MRI.
I think since the last time I talked to you, some of the new things that are going on at Lockport MRI. One thing we've been doing there for a while is breast MRI. We've recently started doing that at Western New York MRI also, and very recently, this past week, we purchased a new piece of equipment, which is called it's called DynaCAD, and what that is, the CAD part of DynaCAD stands for computer-assisted detection, and what that does is it helps the radiologist be more accurate in reading these breast MRIs. You know how important breast MRI is.
That has to be way more advanced than just the normal sonogram and different things that they do.
The use for this is as you know, women go for their regular mammography, and sometimes there's a questionable finding on there, not something that's definitely cancer, but is questionable in the old, you know, you may have to go for a biopsy of this. This is a step where you may be able to characterize what it is that was seen on the breast mammogram better. And by having the breast MRI, that's one, you can have the basic breast MRI, but the new thing that we got, the computer-assisted detection, makes it even more accurate. So all the scans, all the breast MRIs from Lockport MRI and Western New York MRI are being run through this computer-assisted detection to increase the accuracy of it.
Is it more accurate than the mammography?
It's different than mammography. Mammography is very sensitive, but it picks up a lot of things, many of which, actually most of which, turn out to be benign. And this is a method of further seeing whether it's benign rather than having to necessarily go on to a biopsy.
Wow.
And the other thing is, there are some high-risk situations where breast MRI may be done in addition to mammography. Women who have a very strong genetic family history, or may have some just technically it's more difficult to detect cancers, and breast MRI may have a role there.
That's incredible. How good to know. Thank goodness. Absolutely.
We always try to stay at the cutting edge of our technology to provide, the patients in this area the best that's out there. And I think this is just another, step towards that.
Absolutely.
And we're always looking, how to improve services for our patients.
Absolutely. So now you mentioned that that's one of the newest things. Is there anything else that's because I'm going to take you from the newest back to the originals, because even though I was there, some of our viewers might not have seen that program.
Sure. Another thing we'll be doing more of in the near future is TM joints. For people who are having pain, maybe because of headaches, jaw pain, that sort of thing. We have a special, you can't just have an MRI. You also have special coils for different body parts that help you to see those parts of the anatomy. And we have TM joint coils that fit right over the jaw, small coils, and take very detailed images of the TM joints.
And then the doctors would know which way to proceed with their treatment based on that. Very interesting. I think I might be calling for an appointment on that one. Speaking of that, let me interject in here too. So for people who are watching, this is what's so good about me being the co-host here, is that I'm your typical person who's watching the program. So I'm watching today and I'm thinking, well, do I need a doctor to make the prescription? What if my doctor wants to send me somewhere else? And I'm hearing this today and this is where I want to go. Let's talk a little bit about that.
Well, a prescription from your doctor can get you to any imaging center that you choose to go to.
Okay.
Okay. It might have an advertisement of a certain imaging center, but once your doctor has checked off what study he wants performed and he signs that, you can make an arrangement to go to any imaging center, and I hope you choose us because we are the best.
Yeah, and choose them because they're the best and because they're committed. Again, I know I'm sounding like a broken record, but I really do appreciate you being committed to the community and bringing them this information, because it's because of you. You're one of our, as I said, our long-standing corporate sponsors, because you care about the community and you want to bring this information, and you're bringing the best equipment possible. So these are the people that you want to support, the people that support us.
Great. Yeah. Priority one is to take care of the patients.
Yes.
I mean, that's what's very, very important. That's why a long time ago, Krish and I both made a commitment to go to become physicians, is to take care of patients. That was our priority, and that's why we continually try to seek the best imaging that we can for our patients.
Incredible.
And in our particular field, that means you have to keep investing in the new technology, because it just keeps getting better.
Keeps getting better and better.
Absolutely.
And keep abreast of the latest, technology and diagnostic procedures and diseases even.
Oh, absolutely.
Could you diagnose someone, like say at the start of Alzheimer's? Can you do that with a MRI?
Not so much with an MRI, at least at the stage it's at now. I know they're doing a lot of functional brain imaging, and Krish can talk about that a little bit more, but what is very cutting edge technology now is PET CT scanning, which we did have a show a while back.
That's right.
And a lot of new imaging